the Kansas Prevention Collaborative 2021 Year in Review, we adapted. The Kansas Prevention Collaborative accomplished some remarkable things in 2021. We adapted our work as we and the world continue to contend with the pandemic of COVID. Let's roll through some highlights and reflect on our accomplishments. The year 2021 found that Wichita State University Community Engagement Prevention Initiative team adapting to the worldwide pandemic by collaborating and hosting the annual Prevention Advocacy event in January virtually. This event usually takes place in person in Topeka, but by utilizing the Hoover platform, we were able to register a record 72 people to participate. During the week-long activities, the Kansas Prevention Gambling Task Forces, Kansas Suicide Prevention Headquarters, Y-Link, and the Governor's Behavioral Health Service Planning Council Prevention Subcommittee provided meetups and presentations. Legislators participated by scheduling virtual meetings. They also attended some of the meetups and presentations, in which we shared our message of prevention for a stronger Kansas. Hearing from the youth who are leading prevention efforts in their communities was a highlight of the event. Check out some of their comments here.
Because of COVID and stuff, we haven't really been able to do a lot of projects like listen. I was just proud that we were able to organize the virtual meetups themselves. I know that they don't really sound like as grand as everyone else's things, but it's, I don't know. Being like an LGBTQ kid in Kansas, it's kind of hard to like share that information and want to invite people over and be like, hey, let's all hang out and like talk about it, because not a lot of people are interested in sharing that information. So I was happy we were just able to organize it in general and get so many kids on it. Like, I know it's not a lot, but I know we had like at least 5 different high schools on one of ours at one point, and I was just proud of that because, like I said, I know it's really hard to kind of get that information out there.
Personally, one thing that my community, like in Finney County or Garden City, has been struggling with is reaching teens with communication, because now, like currently in our situation with like politics and like where we are at in the world and like how we've evolved like from then, many adults don't know how to like speak respectfully to teens, and that's just been one major problem that I've seen. And because of that, you have teens that are just lashing out and they're just turning to things that aren't the best, like drug use, substance use as a form of like rebellion, call it what you may. And that's just what I've seen in my community. And I feel like of course, you always hear that if everyone just respected one another, but I think it's just if everyone understood one another, like had the perspective of like, yeah, I see where you're coming from, like in like just understanding. And I think that's just one thing that majorly affected the community where I live in. I don't know if it's like that for anyone else, but I think since there's such a big age gap between like teens now and where we're at in the world versus like a parent who's like 20 plus years older than their child, it's just really difficult to talk to sometimes. But yeah, that's personally something that I've seen in my community.
Gen Z has the drive, the passion, and we're out here doing the work. And I don't care what anyone says. And people are going to listen to us whether they want to or not, and they're gonna hear us. We're doing the work. And so my legacy is for everyone older than Gen Z to understand that this is our time and we're not going anywhere.
First and foremost, I want to thank every single one of you for taking time out of your extremely busy lives and contributing to this panel. It was an incredibly impressive panel. What better use of our time than to listen to these voices and to hear about this diversity of all these projects and the diversity of the people who are doing such good works across the state. I'm just overwhelmed. If there's any doubt that the future is bright, hearing the last hour's worth of information diminishes that doubt. We've got some leaders on the horizon who are on the scene as we speak to help show us the way.
Continuing with WSU Prevention Initiative's 2021 highlights, Heather Winkleplex and Janelle Stain hosted 10 Prevention Talks podcasts, which included highlighting coalitions from across the state and the Prevention in Media segment. In 2021, the listeners' top 3 podcasts were Trauma-Informed Care in First Responders with guest Wendy Humble, the Health and Wellness Coordinator for the Sedgwick County Sheriff's Office, Prepped and Ready, Parenting into the Teen Years with Dr. Shayla Savant, a child and adolescent psychiatrist, and Real Resources That Really Help Drug-Endangered Children with Scott Henderson, the Executive Director of the National Drug Endangered Children's Department. The KPC Prevention Talks podcasts are still available to listen to. Go to the Kansas Prevention Collaborative website. With the year 2021 still having a significant impact on the people being able to gather without fear of the COVID virus, there was a growing concern with problem gambling in Kansas.
Yes, and I would say as well that now is a particularly important time to do a lot of that education. Education is prevention, as Joanne said, because of the fact that, with COVID, which has strongly affected the gaming and gambling world. Of course, gaming has expanded exponentially during COVID because of the isolation that people are feeling. And so they've turned to online activities and gaming and esports. So even though sports were not available to be bet on, here just a few months back, people look to esports as a way to fill that need that people have.
This concern was raised during the Kansas Problem Gambling Meetup with prevention professionals and state legislators during the Kansas Prevention Advocacy Week event in January of 2021. With that concern in mind, the Kansas Problem Gambling Task Forces across Kansas adapted and took to the places where the people were. Social media lit up during March in honor of the National Problem Gambling Awareness Month, targeting youth and parents with the warning signs and the message of balance. During that same month, the South Central Kansas Problem Gambling Task Force was featured on the Good Day Kansas program, where Joanne Brills-Klein, the task force co-chair, raised awareness about the free resources available to those that may find themselves struggling with problem gambling. Throughout the year, virtual events popped up across Kansas, including bringing Camadere, an admitted video game addict, to help parents recognize the signs of addiction in their children and for teens to hear his story on the virtual stage. This event was hosted by the Southeast Kansas Problem Gambling Task Force, while the South Central Kansas Task Force offered free virtual workshops with the topics paving the pathways to recovery and gambling and gaming disorders and the youth factor to assist health practitioners in addressing problem gambling. Radio ads made by the Kansas Problem Gambling Coalition could be heard across the Kansas airways, working to adapt, prevent, and promote problem gambling in Kansas. Here is a clip of one of those ads.
The difference between gambling and having a gambling problem is worth knowing. Learn about the warning signs that you or someone you care about could be at risk.
A statewide suicide prevention coalition has been a goal and sometimes a dream of many Kansas for many years, including behavioral health professionals, community suicide prevention coalitions, and state leadership. And in the middle of the pandemic in 2021, that goal and dream was formally accomplished and realized, birthing a mission to champion suicide prevention for all Kansas through equitable access to partnerships, advocacy, resources, ideas, and data, in the hope that it will bring forth the vision of all Kansas united to prevent suicide. And uniting they are. The first official meeting of the Kansas Suicide Prevention Coalition took place virtually on September 21st, 2021, with 80 people in attendance. This great accomplishment was a true collaboration of many agencies across Kansas that continue to adapt and show up. we say thank you. The Kansas University Center for Community Health and Development maintained and provide access to the online community checkbox monitoring and evaluation system and provided quality data management and review. Through mostly Zoom meetings, it trained grantees on participatory evaluation, reviewed data with grantees, and assisted grantees in making sense of their data. They also co-led the state epidemiology outcomes work group to enhance access to quality data for prevention. The 2021 Kansas Youth Community Change Conference didn't let the need to be 6 feet apart and masks keep them from gathering virtually to put on a conference organized by youth for youth. They were creative in adapting the conference by varying the days and times of the workshops. Some facts about the conference are that 157 youth and adults registered. Workshops were offered for youth and parents, and youth attended from across Kansas, including Rush, Reno, Morris, and Sumner counties. Youth that attended had the opportunity to reflect on the changes that the worldwide pandemic was causing in their communities and how they were feeling about it, along with the opportunity to hear from youth about what was going on with the youth in their communities. There were also many opportunities to have fun. Youth attendees stated, "I can't wait to apply all of the skills I learned to my own community. I've learned to expand my leadership skills." The Kansas Prevention Collaborative Connecting Culture Series 2021 was a powerful series of 6 sessions spread out over 3 months with 126 individuals registered. A goal of the series was to reduce and eliminate behavioral health disparities in Kansas. Our diverse group of participants included allies and partners who are Black, Indigenous, people of color, individuals who are LGBTQ+, and those who have experienced disparities of any kind that were willing to share their experiences and perspectives. We engaged in insightful and educational conversations with Sade Heart of the Hawk Ali. Sade is the retired Deputy Commissioner of Philadelphia's Department of Behavioral Health and Intellectual Disability Services. She is now the president of First Nations, LLC, a behavioral health training and consulting organization in Delaware. We participated in the presentation, Culture Humility, Reducing Divisiveness and Increasing Connectedness, with Miguel Gallardo, who conducts psychological assessments in both English and Spanish. He conducts immigration evaluation, legal forensic and medical evaluations, and works with attorneys throughout California. Allison Shaw joins us from North Carolina, where she specializes in treating anxiety, depression, trauma, LGBTQ issues, adjusting to personal and professional life challenges, and sustaining recovery from substance use. We also welcome Kansas experts to provide a powerful panel of voices to discuss their behavioral health experiences in the 3rd session. Here are a few highlights from that conversation.
My name is Dave Sotelo. I am a Human Relations Officer for the City of Hutchinson and a son of prevention work in Kansas. So very proud of that background. So I know a lot of faces here in the room. I like to tell people that I am an immigrant and the son of immigrants.
I'm Abby. I am a representative of KYC, which is Kansas Youth Connect, and I identify as Filipino, although I immigrated here when I was 4. And since then, I always love sharing about my culture to my classmates.
I, throughout the last 20 years, have done a great work within myself to become the best person I could be, to then go out and make a change. And that's why I now own my own business, trying to help others do the same thing.
And one of those protected classes is folks with disabilities and people with disabilities. And so I had an advocate the other day in my office, and he said something that was really was huge for me. And I want to applaud KPC for this. No decision about us without us.
Thank you, everybody, for having me. This is amazing. I love this discussion so far, and just like everybody else, I'm jotting down notes. I'm just really excited.
I can't speak for my entire culture because my entire culture can never speak for me.
Okay.
So because of that, personally in my house, what we value here is we value family. We value each other. We value love. We value joy. We value treating others with the same respect and dignity that we expect from other people.
This is Margaret. I had some individuals that reached out to me privately about really how to connect with individuals in a genuine way. One thing I've come across when we do reach out to individuals is that, they don't trust. We're just here just for our work. And they see right through that to some extent, to where they're told what they need or what they need to connect and how they need to connect, and so they kind of just blow it off. It's sad to say that there are individuals out there that do that for self-promotion, but at the same time, and they do see it. Yeah. So it's really important to, you have to build those relationships, those personal relationships, and to gather with them even after the work is done.
I don't know how we can reach them, but if this is really going to have the greatest impact, this is a great conversation. I think all of the panelists, man, much respect to all of you guys. The things that you've said have just really blown my mind, and I am just so full to know that you guys are out here standing for yourselves and others.
If you would like to view these videos in their entirety, go to the Kansas Prevention Collaborative's YouTube page. In 2021, responding to the increased prevention needs of our veterans and military members and their families in our Kansas communities, the Kansas Prevention Collaborative introduced the Live Connected Kansas initiative. It has a dedicated webpage, liveconnectedks.org, which provides targeted resources, crisis support information, and news about upcoming trainings that service members, veterans, and their families within Kansas can easily access. Live Connected Kansas also went social by establishing a Facebook page to promote the availability of the website and its resources while raising awareness about suicide prevention, current military-related events, and special promotions. To wrap up the highlights for the year, we cannot leave out the 2021 Kansas Prevention Conference. On October 21st and 22nd, participants from across Kansas gathered virtually for the 4th annual Kansas Prevention Conference to learn more about being strong for the next generation. This conference was supported by KDAS and the Kansas Prevention Collaborative. Nationally known Dr. Wanda Boone, founder of Together for Resilient Youth, opened the conference with a moving keynote on social determinants of health and applying a resilience-based, equity-informed lens to the prevention practice. Mo, National Director of Children's Programs at the Betty Ford Center, gave a moving closing keynote on the unique perspective children have in the world of addiction and prevention. He also led a breakout session on his role as an advisor and consultant to Sesame Street as his parental addiction initiative. Check out these quick clips from the conference.
Good morning and welcome everyone to the 4th annual Kansas Prevention Conference. The purpose of this conference is to empower prevention coalitions to redouble their efforts in the community. The theme, Strong for the Next Generation, is meant to remind us that we do this work for future generations.
Thank you, Janelle. And good morning, everyone. I am so happy to see all of you today.
Just my delight to be here to welcome all of you to the 4th annual Kansas Prevention Conference. I'm so delighted to see everyone's faces across the screen.
I love the title of your conference, and congratulations on your 4th year. Strong for the next generation. Beauty is everywhere. We have to say that, mean that, and work towards that in terms of prevention.
Because look how this young girl could separate the disease. Look how big the disease is. And as this 12-year-old girl shared, that's my sister, that's my mom, and that's my dad. Everybody in my family has addiction. And just when I thought she was done, this 12-year-old girl, the tears started streaming down her face, and she looked at me and said, "Am I next? Jerry, everybody in my family gets the disease. Am I going to get it too?" Not necessarily. No, not necessarily. That's where this great prevention work comes in.
Thank you to all of you for taking the time out of your busy schedules to join us this week. I hope that you all enjoyed the conference as much as I did and found it re-energizing for your work.
Wow, this was only the highlights of our work, and there was so much more. This statement, we believe, is true. The Kansas Prevention Collaborative adapted in 2021 to keep all partners and prevention communities engaged, informed, and equipped to carry out the mission of prevention for a stronger Kansas.